Hello, this is Desiree, nurse practitioner student. I'm here to present a SNAPPS case for a patient I saw in my pediatric clinical. So Samantha is a 10-year-old female presenting for a school physical. She is an English-speaking Black American child who recently moved to Florida from New York approximately 2 months ago. The mother asked me to take a close look at the child's ears because she has been complaining about itchiness in both ears. The child reports the itchiness is constant. It isn't painful, but she says it's annoying. The symptoms began shortly after moving to Florida a couple months ago. The child has apparently enjoyed swimming in her apartment's complex pool over the summer and is there swimming approximately every other day. The bilateral pinna are tender to touch, but without notable edema or erythema. Bilateral external auditory canals are edematous and lined with thick yellow-white exudate. The tympanic membrane is barely visible but appears to be a normal pearly gray with no bulging. The patient has not tried any remedies for this problem. The mother and child deny tinnitus, change in hearing ability, foul odor, otorrhea, or bleeding. The patient and mother confirm that the child has not had this problem before. To narrow, I would say, given the history of the symptoms and the physical assessment, my immediate thought is acute otitis externa, fungal. Differential diagnoses include bacterial acute otitis externa, acute otitis media, foreign body in the ear canal, or dermatologic conditions such as contact dermatitis or eczema. Analysis. Acute otitis externa is the highest on my differential diagnosis list given the acute onset within the past couple months, history of frequent swimming, tenderness to pinna, and complaints of itching and irritation. The normal tympanic membrane leads me away from acute otitis media. Any ear complaint from a child does make me consider the possibility of a foreign body or some kind of mechanical irritation in the event that the child is sticking objects into the ear. But in this case, there was no foreign body on exam. Likewise, the nature of the otic exudate leads me away from dermatitis or eczema and towards otitis externa. It just seemed more consistent. The real question for me here is determining the etiology of the otitis externa and treating it accordingly. I understand that otitis externa is usually of bacterial origin, most commonly caused by Pseudomonas aeruginosa and Staphylococcus aureus. The presentation of pruritus with thick yellow-white otorrhea led me to believe this was fungal. I also kept in mind that otomycosis can occur in children, especially those with diabetes or immunodeficiencies. So besides the ear complaint, this child was also obese in the 95th percentile for weight and had acanthosis nigricans discoloration on her neck. Suspicion for diabetes mellitus type 2 was also a consideration that gently nudged me toward fungal otitis externa. Probing. So I'm leaning toward treating with antifungal drops, but I'm also curious as to whether this case could have been polymicrobial. I wonder if the child could benefit from concurrent antibiotic ear drops, or whether she should have been put, if she should have been given one on hold at the pharmacy to pick up in case the antifungal drops proved ineffective. I wasn't sure if there was any interactions or contraindications for doubling up on the treatment. As far as plan, I would begin treatment with an antifungal ear drop for this child, such as clometrazole. And given the child's age, I would ensure that the parent has proficiency in instilling these drops. I would also strongly and repeatedly emphasize no swimming and no submersion until the condition is fully resolved. Because the problem is bilateral, I would also emphasize patience with instilling the drops. 5 minutes on one side lying down, then 5 minutes on the other side. I would also discourage the child from itching or otherwise manipulating the ear in between drops. I would also discuss prevention, such as well-fitting earplugs or gently drying the ears with a blow dryer after swimming. Um, Beyond the acute ear issue, I would also recommend healthy, balanced diet, weight loss, and follow up within 1 week with the primary care provider, both for an ear check and a potential diabetes workup. Selecting, I would like to learn more about identifying and treating both fungal and or bacterial acute otitis externa. I understand that otomycosis can occur secondary to chronic bilateral otitis externa. So I think the potential polymicrobial situation is worth learning more about. I would also like to understand the relationship between diabetes in children and the increased risk of otomycosis. Anyway, that is my case. Thank you for listening.